Good afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor of Madison365, with your daily update for today, which is Friday, April 15th. Sorry if I look a little wonky. My tripod broke, so my camera is literally like perched on top of the tripod, not attached to it. So if things look a little crooked, that's why. A new one coming tomorrow. So let's talk COVID first. We've seen obviously an increase in cases in the past 2 or 3 weeks, not a dramatic increase, not even as dramatic as the Delta surge was back in late July, early August. If you look at the charts at the DHS website, they're just not it's not as steep as it was even then, but they are going up. Although today it's actually down. The 7-day average today was 626. That includes 804 new cases just for today. That was the 7-day average was over 700 yesterday. So that's a bit of a drop off, which is good to see. However, the positive test rate is still pretty high at 5.4%. Relatively high, right? You want it to be below 3. It's nowhere near what it was even through much of January. Going all the way back to like August of last year. So last time we were below 5%. Although, I shouldn't say that. In March, early March of this year, we were below 3%, and it started to come back up. But in terms of in a surge, it was Delta surge that put us over 5% way back in July and August. So it's not good. It's not catastrophic either. But even better news is if this surge in cases was going to lead to more hospitalizations and deaths, we would have started to see that by now. And we're not seeing that yet, right? Typically speaking, if you get an increase in cases, you see an increase in hospitalizations 2 to 3 weeks later. Then you see an increase in deaths 2 or 3 weeks after that. Now we are finishing kind of our third week of this surge. And while we've had a couple of single days where the number of hospitalized people goes up slightly, the overall trend has been downward that entire time. And we're down again today. We're down to 140 people hospitalized. That's a number we haven't seen since middle of last summer. Okay, so that's good. And that might even be higher than we saw last summer, to be honest with you, if I remember correctly. So that's actually 8 fewer than yesterday. That's 17 fewer than a week ago. That's a more than 10% decrease in the past week, which is great. ICU population, a little different story. It's 30 people that are currently in the ICU because of COVID-19. That's down by 3 since yesterday, but that's actually higher than it was a week ago by about 10%, about 4 people. Still, overall trend downward in hospitalizations, even through this entire 3 weeks that we've been seeing higher cases. Similarly, the deaths are now the 7-day average of confirmed fatalities is at 3, which is where it's been for the past 3 or 4 weeks. Okay, so that's also, no death is good. We don't like to see that. We don't see any death as trivial. However, during the Omicron surge, we were losing 39 people a day at the very peak of that. So to see that be at 3 and stay low is good news. So what's happening is cases are surging. They're not leading to hospitalizations. They're not leading to deaths that we know of yet. The deaths might be another week or so before we see an increase, but I don't anticipate an increase in deaths because we haven't seen an increase in hospitalizations, which could mean several things. Could mean this BA2 variant that we're seeing is less severe, just as Omicron was less severe. Original Omicron was less severe. And or it's infecting people who are vaccinated who get sick for a couple of days and are fine. Now, but we don't want to dismiss long COVID either. There's a certain percentage of these folks, vaccinated or not, who will still be dealing with these 804 new cases today. Some percentage of those, it's not clear what percentage. Some say 3%, some say 10%. Somewhere between 20 or 30 of those people who just got confirmed today will still be having symptoms a year from now. Right? That's not dismissible. Right? We don't want to say like, oh, it's fine, everything's fine. Okay. So acknowledging that, we still have to acknowledge that an increase in cases is not necessarily catastrophic at a population level, even though it might be catastrophic at an individual level. at the population level, we can the population of the state can withstand some increasing cases because our vaccination levels are getting there. Right? We're not at 70% yet. We're at where's our vaccination numbers? They're not in the summary data anymore. Oh, there they are. They changed the layout of our summary data today. 64.2% have received at least one dose, and 60.9%, so basically 61%, have completed the series. This is new also. 1/3 of Wisconsinites have received an additional or booster dose. That's a new stat that they haven't shared before. That means there's a lot of people who completed the series who have not gotten boosted yet. Get your boosters, guys. That's very important to do. Okay, so all that is the COVID information. Like I said, basically the summary is cases are going up, deaths and hospitalizations are not. And get your boosters. All right, we'll take a short pause. We'll hear from our sponsor, Madison College, and we'll be back with more local news right after this. Don't scroll away.
Apply yourself this summer. At Madison College, we encourage you to be your truest self. You're an empowered persuader. You exude positivity, and you're not afraid to stand up for what you believe in. Whether it's cool clothes or hot music, your friends count on you to zhuzh it up. For you, life is all about creating a brighter future. And at Madison College, we can't wait to see what you do. Apply yourself this summer.
All right, first thing I want to mention is actually something that is COVID related that we've just learned. Scott Schard of the Capital Times has just reported, and I would imagine if I don't have this in my inbox yet, I will shortly, that Madison School District, I have it. If I get the email from Madison School District, that Madison schools will remain masked through the first week of May. That the mask mandate within the school system in Madison will continue the week of May. They did report 100 new cases last week in the school district. So, and Dane County, by the way, Dane County is actually ahead of, for the first time that I'm aware of, actually ahead of the state in terms of percent of positive tests. So Dane County is actually worse than the rest of the state in those spread numbers. So the mask mandate will stay in the school district for at least a couple of more weeks. Also in the news today, Wisconsin Housing and Economic Development Authority has a new CEO. Elmer Moore Jr. was appointed to that post a couple of weeks ago, March 25th, I believe. And he has a new executive working with him. The new assistant deputy director is Jessica Bowling, one of the founders of the Asian American Pacific Islander Coalition of Wisconsin. She's one of the people responsible for legislation that will require teaching the history of Asian American and Pacific Islander people in Wisconsin schools. She's one of the founders of an organization in Milwaukee called Elevation. And she was on our first ever list of the most influential Asian American leaders in Wisconsin back in 2020. So she will take that role in the coming weeks at the state of Wisconsin, based in Milwaukee. Yesterday, it was a press conference over EW Health. There's a new effort, 4 years in the making, to address disparities in Black maternal and child health. It's called Connect RX, and it will take a holistic approach, understanding that there's a lot of things that determine health and outcomes and for women, Black women, and people giving birth and their children. It's like way, like 5 times more dangerous to be pregnant if you're Black in Wisconsin than if you're white. It's really absurd. But there are many determinants of that. It's not just the doctor. It's the food security. It's the housing security. It's the environmental factors. It's the stress. It's, all that stuff. It's economic issues. So this program will use technology from Epic and other screening tools to help create a whole more holistic approach to that health. The story is at Madison365.org. This is a really brilliant thing. I think, I don't know much of, I'm not an expert in this field, but like I said, they've been working on this. This is the Foundation for Black Women's Wellness, Equity by Design, Dane County Health Coalition, and many other partners all chipping in. As you can see, Senator Tammy Baldwin was here for the announcement, as was the mayor, so such as Conway, and some other healthcare leaders as well. And our Dave Dahmer was there and has that report for you at Madison365.org. Also today, yesterday, Madison College announced a new scholarship specifically for survivors of domestic and intimate partner violence. Ismael Sanchez is the namesake of this. It's the Ismael Sanchez Memorial Scholarship. He was an advocate for survivors of people who experience domestic violence or sexual assault in the Madison area, and often helped abuse victims reclaim their journeys. And was also an advocate for the Latinx community in his personal and professional life. So that scholarship is going to be available starting next year, and the application details and stuff are on the website right now, Madison365.org. And finally, today we have our first candidate for the new 37th Assembly District. As you know, the maps have been redrawn, and the new 37th District, the old 37th District was northeast of Madison. It was like Dodge County mostly, City of Columbus, City of Waterloo. But now the new 37th District will include parts of Sun Prairie and Madison, which will make it a far more left-leaning district, a lot more Democratic voters in the new district as it's constructed now. We should say, so this is a long way to get to the point, that Syed Abbas, who represents District 12 on the Madison Common Council and is currently Common Council president, is going to run for that seat as a Democrat. Now if you know Madison area, you know that sort of Dodge County, that area where the original 37th was, is Republican, and it has been represented by a Republican for well over 10 years. And so this is going to be a change, and the district is going to be much more Democratic and much more urban, frankly. So Syed Abbas is the first Democrat to jump in. I spoke with him briefly this afternoon, so I got some quotes in the story at Madison365.org. I bet there will be more Democrats jump in to a primary. The primary is August 9th. The general election is November 8th. The maps are not final yet. We should say that. But people who in the know believe that if there are any more changes to the maps as it goes through the courts and the appeals and stuff, they'll be around Milwaukee. The 37th, 76th, the 48th, those districts that are kind of around Madison will remain pretty much as they're drawn currently, which means the 37th will become basically a much more Democratic leaning district than the previous 37th. The Republican incumbent has said he wants to run for the 38th rather than try to beat a Democrat in a much more Democratic district. He's going to run for the 38th, which means he's going to have to move because he lives in Columbus right now. So that story again is at Madison365.org. And that's all the news I have for you today. I hope you have a wonderful weekend. If you celebrate the holiday, the Ramadan or Easter or Passover, I hope you have a wonderful holiday with you and your family. And until Monday, take care of yourself. Take care of each other. We'll see you soon. Take care.
This is 365 Media.